Hello, my name is Dr. Clairissa Richardson, Christian, critical disability scholar, and mental health practitioner. Blindness or visual impairment affects roughly 3 million adult Americans and over 4 million for adults aged 40 and older. In the United States, nearly 1/3 of people with blindness or visual impairment experience subclinical depression and anxiety, while around 5 to 7% have a major depressive disorder and 7% have an anxiety disorder, with a higher percentage compared with those having healthy vision, significantly higher. Now, despite data demonstrating an elevated prevalence of mental health symptoms in people with BVI, blindness, visual impairment, this population remains largely untreated. Now, given that people with BVI often interface with multiple systems of rehabilitative care that are designed to improve quality of life, the relatively low rates of initiation of mental health care services are particularly alarming. In this review, the systematic processes of mental health care services across pertinent rehabilitation groups are identified and critically examined. Now, the comprehensive literature review was conducted. The literature review utilized a critical systems typology, whereby relevant literature was selected, reviewed, and analyzed intra and extra-organizationally. The results indicated that interdependencies related to the provision of mental health care services as a resource exist between vocational rehabilitation, VR, orientation and mobility, O&M, and care practitioners involved in the health rehabilitation of people with BVI. Multiple studies offer data indicating the presence of diverse and entangled mental health issues experienced relative to VR-initiated services, mobility tool utility, and emotional reactions to vision loss, and the proclivity for mental health needs to correspond with risk-related factors toward employment, affecting provision and transcending into other health rehabilitative processes. Now, to improve the utility of mental health care services for people with BVI, a re-energization of the mental health care needs of people with BVI must occur. A critical podcast or forum focused on educating listeners about the health rehabilitation factors that influence the provision of mental health care services can really aid to improve future mental health policy and practice for people with BVI. The findings also indicate that disability scholars need to advance research on integrating critical theories in work with people with BVI and accelerate qualitative community-based methods to enhance understanding of this population and their unique mental health needs. Enjoy the article.